Insomnia disorder represents far more than occasional trouble sleeping. It's a persistent condition that affects every aspect of daily functioning and quality of life. Unlike the transient sleep difficulties most people experience during stressful periods, insomnia disorder involves chronic difficulty falling asleep, staying asleep, or achieving restorative sleep despite adequate opportunity to do so. Those suffering from this condition often lie awake watching the hours pass, their minds racing with thoughts, worries, and increasing frustration about their inability to achieve the very thing their bodies desperately need. This sleep deprivation extends far beyond the nighttime hours, casting a shadow over daytime functioning through fatigue, irritability, concentration problems, and diminished performance in work, school, and personal relationships. The disorder manifests in several distinct patterns that create different challenges for those affected. Sleep-onset insomnia involves persistent difficulty falling asleep at the beginning of the night, with sufferers often reporting they lie awake for hours before sleep finally arrives. Sleep maintenance insomnia presents as fragmented sleep with multiple awakenings throughout the night, preventing the continuity needed for truly restorative rest. Early morning awakening insomnia, particularly common in older adults and those with depression, involves premature awakening with inability to return to sleep despite feeling incompletely rested. Many individuals experience mixed patterns that shift over time, reflecting the dynamic nature of sleep disturbances. Regardless of pattern, the impact on daily functioning remains significant when sleep disruption occurs 3 or more nights weekly for 3 months or longer, the clinical threshold for chronic insomnia disorder. This condition develops through a complex interplay of predisposing, precipitating, and perpetuating factors unique to each individual. Some people possess inherent vulnerability through genetics, personality traits like perfectionism or heightened emotional reactivity, or physiological characteristics that create what sleep scientists call hyperarousal, essentially an overactive alertness system. These predispositions may remain dormant until activated by precipitating events like major life stressors, illness, medication effects, or significant schedule changes. While many people experience temporary sleep disruption during difficult times, those who develop chronic insomnia enter a cycle of perpetuating factors that maintain the problem long after the initial trigger resolves. These maintenance factors often include maladaptive sleep habits, excessive concern about sleep, conditioned arousal to the bedroom environment, and disrupted circadian rhythms that resist normalization. The physiological consequences of chronic sleep deprivation extend throughout virtually every body system, creating both immediate and long-term health risks. Cognitively, insomnia impairs attention, concentration, learning, and memory formation, with performance deficits comparable to alcohol intoxication in severe cases. Emotionally, sleep deprivation amplifies reactivity while diminishing coping resources, creating heightened vulnerability to stress, anxiety, and mood disturbances. Metabolically, disrupted sleep interferes with glucose regulation, appetite hormones, and energy balance, contributing to increased diabetes and obesity risk. Cardiovascular effects include elevated blood pressure and inflammatory markers that, over time, contribute to heart disease risk. The immune system likewise suffers, with reduced infection-fighting capacity and increased inflammatory response. Perhaps most concerning, mounting evidence suggests chronic sleep disruption may even accelerate brain aging and increase vulnerability to neurodegenerative conditions. Accurate diagnosis requires comprehensive evaluation that considers the multiple factors potentially contributing to sleep disturbance. Clinicians typically begin with detailed sleep history assessment, often asking patients to maintain sleep diaries that track patterns over several weeks. Screening for other sleep disorders is essential, as conditions like sleep apnea, restless leg syndrome, and circadian rhythm disorders can masquerade as or coexist with insomnia. Medical evaluation helps identify physical conditions or medications that might disrupt sleep, while psychological assessment explores mental health factors frequently intertwined with insomnia. In some cases, sleep studies conducted in specialized laboratories provide objective data about sleep architecture, breathing patterns, and movement disorders that subjective reporting cannot capture. This multifaceted assessment process informs individualized treatment planning addressing each patient's unique constellation of factors. Cognitive behavioral therapy for insomnia, CBT-I, has emerged as the gold standard treatment, demonstrating effectiveness comparable or superior to medication with more durable benefits and minimal side effects. This structured approach targets the specific thoughts and behaviors that perpetuate insomnia through several key components. Sleep restriction temporarily reduces time in bed to consolidate fragmented sleep, creating mild sleep deprivation that eventually strengthens the sleep drive. Stimulus control breaks conditioned associations between the bedroom and wakefulness by establishing strict rules about bedroom activities and responses to nighttime wakefulness. Cognitive restructuring addresses dysfunctional beliefs about sleep that generate performance anxiety and catastrophic thinking. Sleep hygiene education helps optimize environmental factors and daily habits affecting sleep quality. Relaxation training provides practical tools for reducing physiological arousal at bedtime. When delivered by trained providers, this comprehensive approach typically yields significant improvements within 6 to 8 weeks and maintains benefits long after treatment concludes. Medication approaches to insomnia require careful consideration of benefits, risks, and individual patient factors. Prescription sleep medications include several classes, each with distinct mechanisms and considerations. Benzodiazepines and newer benzodiazepine receptor agonists, Z-drugs, enhance GABA activity to promote sleep but carry risks of dependence, tolerance, and cognitive effects, particularly in older adults. Sedating antidepressants like trazodone offer alternatives for those with comorbid mood disorders, but may cause daytime sedation or orthostatic effects. Melatonin receptor agonists help regulate circadian rhythms with minimal side effects, but modest efficacy. Orexin receptor antagonists represent the newest medication class, blocking wake-promoting neurotransmitters without many traditional sleeping pill side effects. While these medications provide valuable options for short-term management or specific situations, most sleep experts recommend them as adjuncts to behavioral approaches rather than standalone treatments, particularly for chronic insomnia. The relationship between insomnia and mental health reflects a bidirectional interaction where each condition can trigger or exacerbate the other. Historically, insomnia was often viewed merely as a symptom of conditions like depression or anxiety, but contemporary understanding recognizes it as an independent disorder requiring specific treatment. Research demonstrates that treating insomnia often improves mental health symptoms, while untreated sleep problems can undermine psychiatric treatment effectiveness. This recognition has led to increased implementation of transdiagnostic approaches that address sleep and mental health concerns simultaneously. For those with comorbid conditions, integrated treatment addressing both sleep disturbance and psychological symptoms typically yields superior outcomes compared to approaches targeting either condition in isolation. Lifestyle factors play crucial roles in both preventing insomnia and supporting recovery alongside formal treatments. Regular physical activity promotes deeper sleep and reduces sleep onset time when performed earlier in the day, though intense exercise close to bedtime may be counterproductive for some individuals. Dietary choices affect sleep quality through multiple mechanisms. Caffeine's obvious alerting effects can disrupt sleep even when consumed many hours before bedtime, while alcohol, though initially sedating, fragments later sleep cycles. Managing technology use represents a particular challenge in modern society, as blue light from screens suppresses natural melatonin production, while engaging content delays bedtime and activates the mind. Developing consistent sleep-wake schedules that align with individual circadian preferences helps establish reliable sleep patterns, though this often requires difficult lifestyle adjustments in a society that frequently demands schedule flexibility. Special populations face unique insomnia challenges requiring tailored approaches. Children and adolescents experience developmentally specific sleep disruptions complicated by school schedules often misaligned with biological sleep preferences. Older adults contend with age-related changes in sleep architecture, increased medical comorbidities affecting sleep, and medication effects. Shift workers struggle to maintain consistent sleep patterns while working against natural circadian rhythms. Pregnant women navigate hormonal fluctuations and physical discomfort that disrupt sleep, particularly in the third trimester. Individuals with chronic pain experience bidirectional interactions where pain disrupts sleep, while sleep deprivation lowers pain thresholds. These diverse populations benefit from specialized adaptations of standard insomnia treatments that address their specific circumstances and needs. Despite significant advances in understanding and treating insomnia, the condition remains underdiagnosed and undertreated for many individuals. Patient education about normal sleep, realistic expectations, and evidence-based treatment options plays a crucial role in addressing this gap. Growing availability of digital therapeutics delivering CBT-I components through mobile applications has expanded access beyond traditional clinical settings. Sleep specialists increasingly emphasize the importance of personalizing approaches based on each patient's specific insomnia subtype, comorbidities, and preferences rather than applying one-size-fits-all protocols. While achieving perfect sleep remains an elusive goal even for good sleepers, modern approaches offer effective paths for most insomnia sufferers to achieve meaningful improvements in both sleep quality and daytime functioning, transforming nighttime struggles into the restorative experience sleep is meant to provide.